Welcome to First Call's Basic First Aid Training. No matter where you are, you may encounter situations where basic first aid knowledge could make a real difference. This training will cover essential skills that every person should know. Remember, first aid is about providing immediate care until professional medical help arrives. Let's start with bleeding control and wound care. Understanding how to respond to bleeding injuries is one of the most important first aid skills you can learn. There are three main types of bleeding. Capillary bleeding involves small blood vessels and typically appears as oozing from minor cuts. Venous bleeding comes from veins and flows steadily with a dark red color. Arterial bleeding is the most serious, coming from arteries with bright red blood that spurts or pulses with the heartbeat. For any bleeding injury, your first priority is direct pressure. Place a clean cloth, gauze pad, or even your hand directly over the wound and apply firm, steady pressure. Don't peek under the bandage to see if bleeding has stopped. This can disrupt clot formation. If blood soaks through, just add more material on top and continue applying pressure. When providing wound care, including wrapping a wound, it is best to start at the farthest point and work your way towards the heart. While wrapping a wound that is bleeding with a roller gauze, if you give the gauze a twist when you come up over the top of the wound, it would put a little more pressure on the cut and help control bleeding. As you near the end of the roller gauze, in order to tie the gauze off, continue the wrap in the natural direction, but bring the loose end back on itself. Then you can tie it in a knot or a bow tie, like you would with a pair of shoelaces. Tying the knot over the wound can add a little more pressure directly onto the wound. When bandaging, wrap snugly, but not so tight that you cut off circulation. You should be able to slip one finger under the bandage. Check that fingers or toes beyond the bandage remain warm and normal in color. For minor cuts and scrapes, clean your hands first, then gently clean around the wound with water. Pat dry and apply a bandage to keep the wound clean. Change the bandage daily or when it becomes wet or dirty. Puncture wounds require special attention. Don't remove any object that's still in the wound. This could cause more damage and bleeding. Instead, stabilize the object with bulky dressings around it and seek immediate medical attention. Shock occurs when the body's organs don't receive enough blood and oxygen. This can happen with serious injuries, severe bleeding, or medical emergencies. Watch for these signs of shock: pale, cool, or clammy skin, rapid, weak pulse, rapid or shallow breathing, nausea or vomiting, weakness or dizziness, and restlessness or anxiety. To treat shock, first ensure the person's airway is clear and that they're breathing. Control any obvious bleeding. Help the person lie down and elevate their legs about 12 inches unless you suspect a head, neck, or back injury. This helps the blood return to the vital organs. Maintaining body temperature is crucial. Cover the person with a blanket to prevent heat loss, but don't overheat them. Loosen tight clothing and provide reassurance while waiting for emergency medical services. Burns are classified by their severity. First-degree burns affect only the outer skin layer, causing redness and pain like a mild sunburn. Second-degree burns go deeper, causing blisters, swelling, and more intense pain. Third-degree burns destroy all skin layers and may appear white, brown, or charred. These are medical emergencies. For first and second-degree burns, immediately cool the burn with cool running water for at least 10 minutes. This stops the burning process and reduces pain. Remove any jewelry or tight clothing from the burned area before swelling begins. After cooling, loosely cover the burn with sterile gauze or clean cloth. Don't use ice, butter, or other home remedies. These can cause more damage. For small first-degree burns, over-the-counter pain medication can help with discomfort. Never cool large burns with water, as this can cause hypothermia. For third-degree burns or burns larger than the palm of your hand, call emergency services immediately and cover with a clean, dry cloth while waiting for help. Sprains affect ligaments, the tissues connecting bones at joints. Strains affect muscles or tendons. Both can cause pain, swelling, and limited movement. The RICE method is your go-to treatment for minor sprains and strains. Rest means stopping the activity and avoiding putting weight on the injured area. Ice should be applied for 15 to 20 minutes every 2 to 3 hours for the first day or two. Wrap ice in a thin towel. Never apply ice directly to the skin. Compression with an elastic bandage helps reduce swelling. Wrap snugly, but not tightly enough to cut off circulation. Elevation means raising the injured area above the heart level when possible to reduce swelling. Seek medical attention if you hear a popping sound when the injury occurs, if you can't move the injured area, if it becomes numb, or if you see signs of infection, like increased redness, warmth, or red streaking. Heat-related illness can occur in warm environments or during physical activity. Heat exhaustion symptoms include heavy sweating, weakness, nausea, headache, and dizziness. Move the person to a cool area, loosen clothing, and apply cool water to the skin. Have them sip cool water if they're conscious and not vomiting. Heat stroke is life-threatening. The person may have hot, dry skin or may still be sweating. They might be confused, have a high body temperature, and could lose consciousness. Call emergency services immediately. Cool the person aggressively with whatever means available while waiting for help. Hypothermia occurs when body temperature drops dangerously low. Watch for shivering, confusion, drowsiness, and slurred speech. Move the person to warmth, remove wet clothing, and wrap them in blankets. Handle them gently as their heart may be vulnerable to sudden movements. Remember, first aid is about providing immediate care until professional help arrives. Always call emergency services for serious injuries or when you're unsure about the severity of a condition. Your safety comes first. Don't put yourself in danger to help others. Keep your workplace first aid kit stocked and know where it's located. Consider taking a hands-on first aid course to practice these skills. At First Call, we believe that prepared employees create safer workplaces for everyone. The skills you learn today could help save a life or prevent a minor injury from becoming serious. Thank you for taking the time to learn these important first aid basics. Have a great day.